just very happy to be here with you all this afternoon and to add some more to the book. I would imagine everybody in here has read or has participated in conversations or has some things they've had to do in their class in regard to the book, Being Mortal. I was first exposed to the book about a year or so ago when somebody from the Common Reader Committee came to one of our nursing division meetings and wrote the book and said, you know, this book has a lot to do with healthcare, so we thought you all would want to be involved in it. And so when we really got into the topic, because of my additional background in working with hospice, I was given the book, and I just absolutely love the book because it is so real and it is so needed in our lives today. You know, one of the things that is so very hard for all of us is to even think about our own mortality, much less that of our loved ones. You know, we can think about it up here, but do we really embrace what that means unless we've had some personal experiences? And so many of us, we don't even have those kind of experiences until we're in our older years. We might have a parent that passes away. Some of us don't even have any experiences early on. So it's really hard to say, yes, I know what that means, but what does that mean for me and for my family? So one of the things I would say about working with hospice, I've been able to be very intimately involved with families at the end of life and helping them understand about how to care for patients at the end of life. So I'll tell you just a little bit about hospice, and then I want to tell you some things that you might not realize about hospice, some of the really neat and, you know, we've had some funny stories and some really good stories. I want you to have a positive feeling about hospice. So hospice is it's a national organization, but it's also sponsored by Medicare, so that our patients at the end of life, if a physician certifies that in his best medical opinion, a patient has 6 months or less to live, given their condition as it exists now, they would be eligible for hospice and be covered by Medicare. So usually a patient has that first discussion with their physician, and this may be somebody that has just found out that they have a terminal illness, or it could be somebody that's been fighting a terminal illness for a long time. It could be somebody that's been trying all kinds of treatments, possibly surgery, possibly chemo, possibly radiation. And maybe they've tried everything that's available to them. And they may be to the point that if they try anything else, it could actually be harder on them than to not try anything else and just to accept comfort care. And that's what we talk about when we say hospice. We talk about comfort care. So hospice, one thing that's important to know, that hospice doesn't speed up or slow down the dying process. It supports the dying process. That means we do everything in our power for each and every patient and their families to make sure that they are safe, they are comfortable, and it's done in a dignified manner. So one of the first things we do after we have a hospice referral is we do an admission visit with the patient. This is where we learn about the patient, their situation, what their wishes are. Just like Reverend McCann said, you want to really find out about what their wishes are and what's their family's wishes. Then we're going to customize their care plan so that whatever they really want to do, if it's safe and we can make it happen, we're going to help them make it happen. A lot of times when I first go in for a referral visit, I have seen situations where families are at various stages of acceptance. The patient may be accepting of their condition. but there may be children or maybe a spouse that is not accepting it. So we have to be very careful and very sensitive when we go in so that we respect each and every person that we're talking to, because we can't force anybody to be at a certain place that we think they ought to be, right? Nobody can force anybody else to say, well, you just need to suck it up and do this. No, you have to help people come along. You have to work with them. You have to let things evolve over time so that they can get to a place of peace and comfort. Now, some of the things that we would do for patients that you might not think about. We, many times we'll have patients and we'll say, what would you really like to do? You know, your health is reasonably good and we can support you in doing different things. Some people just want to get out and go to church. Some people want to go out to eat occasionally or go out to visit friends. Some people want to go on trips. So we've had people recently go to Florida. We've had people go to Las Vegas. We've had people go as far as Hawaii. Now, we're going to make sure that happens in a safe way, right? So what we do is we contact the hospice organization in that particular area where they're traveling, and we make arrangements for that patient to be covered by that hospice while they're in that location. And so it works very well. I've worked a lot on the weekend for hospice, and I would get the call saying, okay, we're leaving to head to Florida. And I'd say, okay, just call me when you get there. And so when they get there, they'd say, we're here, we made it. And then I would contact the hospice in that local area, and they would take over for us. So patients, I can't tell you how much that means to them if they're able to do things like that. We had one patient that he liked to go fishing. So many times when I would come on the weekends, I would say, where is Mr. So-and-so? Well, he's at the lake, or he's at the local fishing hole, or, you know, all I had to do was know where he was in case I needed to go check on him. So we're very flexible about things like that. A lot of what we do has to do with teaching family basic skills that they need to take care of a patient in a home setting. Most of our patients are cared for in their home setting. And if you would look back at the research, and I believe it's in Dr. Gawande's book, the vast majority of us, when it's our turn and when we are questioned, we want to be in our home setting with our family, with our friends. We don't want to be in a hospital if we can avoid it. So that means that we have to help those families learn how to do basic nursing care that they might need to give in a home setting. And I have seen people come from that very first visit where they're absolutely terrified, but they are committed because this is what their loved one wants. They want to be in a home setting. They want to stay around their family and friends. And so we go in, we figure out what they need in their particular setting. Do they need a hospital bed? Do they need a device to help them lift the patient? What kind of bathing facilities do we need to set up for? All those kinds of things. Now we have a whole staff. We have a chaplain, we have a social worker, we have registered nurse case managers, we've got nurses aides, we've got a volunteer services coordinator, and many times when I come and talk about hospice, she comes with me and tells stories about the different things that we do as well. I've seen some things that were so simple and so basic to me as a nurse for 51 years that I would, if you're not being careful and you're not being sensitive, you might not realize that the family truly doesn't know how to do certain things. I can remember one time I went into a home setting. The patient was fairly young. The children were younger than my children, and they were the caregivers. And I went into the room, and we were straightening the patient up in the bed, and they did not realize that the bed would raise up. If you try to lift a patient in a bed and you have to bend down, it's a lot harder than if you know that the bed comes up. And I wish you would have seen the look on their face when I just showed them how to make the bed come up. Now, to me, that is so, it's just ingrained in me after so many years. But they were just overwhelmed that I could give them that little bit to help them make it easier on them. And we've seen it so many times. We do Christmas caroling with the patients, we do birthday parties, we've had baptisms, we've had weddings. Sometimes Kroger's florist brings us flowers and we separate them out and take them out to our patients. We do all kinds of things, anything we can think of that will help make the patient's time as best it can be. And as Dr. Gwande says in the book, it's all about the quality. Safety is absolutely important. Comfort is absolutely important. But to get that quality that people want at the very end is really what it's all about. So do you all have any questions? If not, you're welcome to stop me or call me anytime if you have any questions that are related to hospice. And I truly love the book.